Uterine fibroids affect millions of women, yet many don't realize they have them until symptoms become disruptive. Joining us this morning is Dr. Elizabeth Hultgren to break down what fibroids are, the signs to watch for, and treatment options. Thanks for being here.
Yeah, thanks for having me. I appreciate it.
Tell us a little bit about how this affects women.
Yeah, uterine fibroids are essentially overgrowth of the muscle or a tumor of the muscle of the uterus itself. About 80% of women have them by the time they reach menopause, so they're extremely common. But as you said, most women will never know that they have them until they start having symptoms secondary to them.
Yeah, and so what are some of those symptoms or maybe early signs to look out for?
Yeah, so uterine fibroids will typically present to my clinic with heavy bleeding, maybe intermenstrual bleeding or bleeding actually between your periods. You might notice that your bleedings become heavier, more crampy associated with the time of your cycle. You also may have more what we call mass effect. So this is essentially where you might start having actually symptoms due to the sheer size of your fibroids. Pressure on the bladder, pressure on the rectum, they can press in nerves. Some people may present initially with like back pain or sciatica. And so really any of these can be really common symptoms of women with fibroids.
Yeah. So if people maybe have some of these symptoms, what do you recommend they do then?
So if you have a concern, certainly talk to your primary care physician, your family practice provider, your internal medicine physician, or if you have an OBGYN, chat with them. Typically we'll start with getting a history, doing a physical exam, potentially getting some imaging, so having things like a transvaginal ultrasound performed, where we can actually look at the tissue, so look at the structures, look at the anatomy, identify what those ovaries look like, what the uterus looks like, and that would be a time that we'd actually diagnose the presence of uterine fibroids.
What are some of those treatment options or things you can do to help this?
So the treatment for fibroids have really come a long ways.
Okay.
It used to just be, okay, you have fibroids, we're gonna do a hysterectomy. And so we actually have a lot of options these days. So typically, if people are wanting to stay more conservative, we're gonna start with medications. Medications like progesterones, medications such as hormonal IUD. And then if that's not working, we can also switch to our GnRH agonist or antagonist. These are medications that you would take daily, but are actually gonna block the effect of hormones on the fibroids to help them from growing in size and may actually shrink that size. There's also been a large development in what we can do surgically. A lot of us really practice minimally invasive medicine, minimally invasive surgery for use of fibroids. And so we used to just think, well, if you have fibroids, take the whole thing out. And really, we have a lot of other options. We can now do what's called myomectomies, which is where we surgically go in and actually just remove the fibroid itself, leaving the rest of the uterus in situ or in place. We can do what's called radiofrequency ablation, and this is one that I'm personally excited about. This is a newer technology that we've really invested in the past 5 to 10 years, where we can actually go in and actually put little like metal tines into the fibroid itself. We use heat to cause what's called coagulative necrosis, or essentially cell death of the fibroid itself, causing that fibroid to go from being like really firm and large, like a baseball, to actually shrinking it to be more soft and smaller, such as like a marshmallow is kind of the example we use. And then finally, there is really that definitive management with a hysterectomy. But even with that, the ability for us to do minimally invasive surgery has really expanded in the past 5 to 10 years. So I would say very rarely are we doing large open procedures for fibroids anymore. Very rarely people are spending the night in the hospital for these type of procedures, and we're able to do it in a minimally invasive fashion to really have the least disruption for people's lives as they heal from these surgeries as well.
Yeah, for sure. Well, thank you so much for being here and
Yeah.
sharing a little bit about this and raising awareness to something so common for a lot of women.
Absolutely, thank you.
Stick around, we have more after the break.